All right, well, I'm going to get us started even though we have a dark screen. And Alex, if you can work on that, that would be great. So I just want to welcome folks as we're having folks join us for our very special meeting on behavioral health resources. And as people join, just to catch everyone up, we've been doing trainings countywide on an ambassador program. And that program is really intended to make sure that we have community leaders who know enough about COVID-19 to educate their friends, neighbors, and family members and service clubs and schools and all of that. So I want to say thank you to each of those leaders who have joined us. After our first training, I got a call almost immediately, maybe even during the meeting, from David Mineta. And David said, you know, there are a lot of people in our community who are really struggling with behavioral health issues, mental health issues, and they need help. And we have an opportunity to do even more education about the resources that are available. I was so grateful to him for his great idea, and really grateful to Sherry Trejo, who runs our behavioral health department for the County of Santa Clara, and Dr. Marianne Duwan for their leadership in agreeing to be to walk us through what the resources are for our community. And the goal for today is to make sure that you have the resources you need personally for yourselves and your families and your communities, and as ambassadors that you have enough information to make sure that you can share and reach out to the community about what resources are available. Let me just wrap up my section by saying a couple things. One is, I know this is a time of tremendous pain, frustration, isolation, and for some, a deep feeling of hopelessness. And I know for many of you community leaders, you are in a position right now where you're the repository for a lot of pain and suffering from the community. So today we want to make sure you have the resources you need to take care of yourself as community leaders, but also that you have the ability to share resources with our community that is so very, very much in need. So with that, I'm going to turn it over. One last thing, I'm sorry, just a housekeeping issue. We're recording this session, and we got a lot of requests to record this session so that we'd be able to share it with others in our community. So I just wanted to make you aware that we're recording. And for most of you, I know that's not a problem, but I just want to make sure everybody knew that. But I also wanted to let you know that if there's a lot happening and you want to take it in and you're not able to take notes, no problem. You'll be able to access it. And for those of you who've signed in, we'll make sure you get the slides after the presentation today. So again, I want to thank our three presenters. I'm really excited to hear from all of them. I appreciate each and every one of you. Thank you all very much for joining us. And with that, I'm going to turn it over to David Mineta.
Great. Thank you very much, Supervisor Chavez, and thank you so much for both creating the COVID Ambassadors Program, but you may be equally as important having the second session of and the first training of the COVID Ambassadors to be the topic on behavioral health. I mean, I just think that says everything, that the second, the second meeting of the ambassadors is around behavioral health. And that is all to you and your staff. And I just want to thank, again, you and your staff for doing this. So it is quite the honor to be on this training panel with Superintendent Marianne Duwan from the county, Santa Clara County Office of Education, and Director Sherry Trejo from the Santa Clara County Behavioral Health Department. And so it just is such an honor to be here. Again, my name is Dave Mineta. I'm the CEO of Momentum for Health and also the president of the Behavioral Health Contractors Association. Again, thank you all for joining us today on this wonderful, beautiful Saturday. And I just can't thank you enough for taking time today. We want to actually, we're doing some polls today. We want to actually check in with folks to see, how you're doing, how you're feeling. And so today, we're going to do this a few times, and we want to actually, so the first question, and this is a Menti poll, is just want to see how you are feeling today. So we want to try it out. And Alex is going to start sharing So on your screen now is how are you feeling? That's the question. But you have to go to www.menti.com to take the poll. So we want to actually do this now, and you have to actually code in each time we do a poll. You have to code in a separate code. So the code now is 7803323. Okay, and Kathy put that in the chat. Please go to www.menti.com, put in the code, and people are doing it. Awesome. That is so awesome. And the more we do it, the more, it'll get bigger, it'll get smaller, depending on how we answer. So again, that's awesome that we can see it happening. Thank you all. Very good. All right, so just give you just a little, just keep doing this. Is pretty cool. It's pretty cool to see. And all range of feelings today. And, even in the sunshine for sure, feeling a bit overwhelmed still, tired, hopeful, relaxed. Good to see these. Thank you all. All right. And again, we will have a couple more questions today. So, Alex, I think maybe in another few seconds, we can go back over to the agenda. I think somehow, I don't know how, but I feel like I'm all over. I would say I'm like most of those feelings. I don't know if that's possible. Is that possible? Yeah, I guess so. Lots of different feelings. Okay. It is possible. Thank you. Thank you, Carmen. Yes, that is. So our agenda today, again, I just want to go quickly through this and get into the actual meat of the slides and our training. Thanks. So we're going to talk generally just about the impacts of COVID-19 on behavioral health, and all the things really that that are factors in how we're feeling. We're going to talk about protecting our behavioral health and wellness, and also the behavioral health supports and services. And we're going to have kind of as a takeaway for folks Director Toral Sherry has actually created a takeaway and a one-pager for folks so that if you have questions, there are numbers to call, key numbers and hotlines and all. So next slide, please. Thank you. So a bit about so much that's going on. I saw that overwhelm on the how you're feeling today. And when you look at this, this slide, it's broken up into four main areas of what we're talking about today is crisis and urgent behavioral health needs, and all the things that we're looking at and as indicators, and all underneath, what we see as needs, behavioral health, urgent behavioral health needs. And connected to that, though, are feelings of isolation and you're not feeling connected and just feeling so distant from what you would normally be your supports, family, friends, work, being at work, but also just general fears and concerns around finances, job loss, health, uncertainty. But then also these new issues around technology, just trying to be connected to folks right now could take a fair amount of technology. So you have virtual access to your classes and to work and the proper equipment. So one of the things that we wanted to actually talk about today and to really put a focus on is on these elevated adverse mental health conditions around, our own mental health, substance use disorder, suicidal ideation, which have all been documented by CDC, by the Substance Abuse Mental Health Services Administration, SAMHSA, and the federal government as all being elevated. And I want to leave you with three key indicators. One is that anxiety disorders and depressive disorders have approximately have increased about 3 and 4 times respectively than the levels they were in 2019. So in 2020, those levels are 3 and 4 times greater for both anxiety and depression than they were the year before. Also, we've seen increased levels of suicidal ideation across the country. And also, for kids, we've seen an increase in the number of mental health related emergency department visits across the country for both groups of 5 to 11-year-olds and 12 to 17-year-olds. These are increases of approximately 24 to 31% increases from periods from the previous year in 2019. And this is federal data looking at emergency department visits. So again, lots of the data is all showing us lots of concern and around behavioral health, mental health, and substance disorder issues. So what can we do about this? Next slide, please. There are many ways for us to process all the stress and emotions in positive ways, in really healthy ways. And I think this is a very important message for us all as ambassadors to get out into our communities, is that we are much more resilient as a community when we're connected, and as families and all, when we are connected. And also that there is recovery happening all around us. Folks continuing their recovery, maintaining their recovery, starting their recovery, even in the pandemic. So how are we doing this? One, these are some suggestions on how to do this from the Behavioral Health Services Department. One, be around folks who are positive by Zoom, by phone, by text. Again, take the time to ask how folks are doing. That's that connection, right? How are you doing, particularly our kids and young ones. And I don't want to go through this whole list, but I just wanted you to know that as for the slide deck, as it comes out to everybody, these are 8 ideas. There are many, many more, right? Think about the ones that around, exercise and sleep, eat, get good sleep, eat well, eat healthy, get some exercise, man. And as we get some nice days in here, as soon as we're done with the training, great to walk outside. So before I turn over my part, we also wanted to just check for questions. And I want to say also that I'm very pleased to actually be joined by our manager from the Crisis Stabilization Unit, the Adult Crisis Stabilization Unit here in Santa Clara County. Momentum runs the adult side, Uplift Family Services runs the Youth and Adolescent Crisis Stabilization Unit, both contracts with Santa Clara County. But I'm part of this, what I was presenting today was from our manager from our CSU, Bindu Karana Brown, and I just want to thank her for all that she's done during the pandemic, because the CSU has been such a vital part of the response in the county. So with that, I will turn it over to Director Terrell, who will talk about some of the resources locally. And actually, Alex, I don't know if we had time for the questions, and let me just double check.
Yes, thank you, David. So this is Victor with Supervisor Chavez's office. And so we ask if you have any questions that you please press the blue raise your hand button, and we will allow you to unmute. to present your question. At this time, we have no hands that are raised. Might want to give a few more seconds.
I might recommend that we take, this is Cindy, just maybe 2 questions and then move on to each section, because I think sometimes questions get answered after the presentations.
Yeah. And then there's so much information on the way to Victor that we could actually, I think some of the slides that are coming are going to actually prompt maybe questions and as Cindy said, answer them as well. So why don't we just move out on the next slide?
All right. Thanks so much, Dave. And thank you very much, Supervisor Chavez, for inviting us to participate today in this really important training. And thank you to all of the ambassadors who have joined us and to the members of the public who are with us today to gather additional information on behavioral health. As Supervisor Chavez opened, I think, to take a moment to reflect and acknowledge just how difficult this pandemic has been for so many. I think about in my own experience, sometimes time feels as though it goes forever slow. And other times you look at the calendar and you think, wow, we've been through so much over time. And so, days kind of roll into the next day. I think the issues around separation between work and home and life, everything's really continuously blended together. And, we really appreciate all that you're doing in the communities, reaching out. And, I think for myself, I think about my parents who are a far distance and the fact that I have not been able to see them for a year. They're elderly and it just hasn't been possible. I think about, that I haven't been able to connect with other family members who in regular times I would be seeing during different points in the year. So we each hold our own experience, our own challenges, our own difficulties during this time. And it impacts us in so many different ways that we can't even really anticipate. This is, as many say, an unprecedented situation, one which we have never experienced before. And I think some of the information that Dave shared in the opening slides is really relevant because, just given the circumstances, there has been that tremendous increase in needs and actually experiences around behavioral health that I think we had not experienced in previous times. So on this slide, I wanted to share just some local resources. The way in which this slide is grouped is the first part of what we're providing is our crisis support services. So within the County of Santa Clara, we offer our behavioral health suicide and crisis line. That line is 24/7. So anyone who is experiencing a crisis or needs to speak with someone, that line is available. We have folks that are trained to be able to answer those calls, and it's a really good resource. The other resource for those who may not want to call and speak to someone is our crisis support text line. And so the way this works is you would take your phone and text renew to the number on the screen, and someone would immediately be able to respond back to you. So that's a really incredible way of connecting with someone when you may not want to, talk over the phone. And, I think what we've experienced actually during the initial parts of the pandemic and throughout this pandemic has been a very significant increase in the utilization of our crisis support text line. We've seen an increase in the use on the part of adolescents and young adults, as well as adults throughout the community. The next support service that I wanted to highlight is our mobile crisis response team. This is a 24/7 team as well that will go out into the community. So if you or someone may be experiencing a mental health crisis, you can call that number. And at times, some of these crises can actually be what we refer to as triaged or supported by phone. But if it is a situation where it requires a team to go out, we have licensed mental health clinicians who will go out and respond to the home or in the community, wherever that crisis is. And they will help de-escalate, provide support. Sometimes they may need to take further action and actually help the person access supports through hospital. But that's a really good response team if you or a loved one or someone in the community really needs that immediate crisis response. We also have a mobile crisis response team and number for children and youth. And so if this is for a younger person in the community up to the age of 18, you can call the Uplift Family Services mobile crisis line, and that team will respond to any crisis involving a child or adolescent. The next set of information is related to accessing behavioral health services. So this is a situation where you may need to access support or want to be connected to a mental health service. And this is a time when you would not be in an immediate crisis, but just need a connection perhaps to outpatient counseling or maybe another type of mental health support. We have these different numbers that you can access to call to get information on services. So we have our 800 number for our behavioral health call center. And then we also have a separate line for those who may need substance use treatment services. And there's a separate line for adult substance use treatment and children's substance use treatment. So those numbers are there as well. And then we also have a youth substance use treatment service line that you can call after hours. Finally, we have a couple of additional resources that we think are really helpful. There's a County of Santa Clara Facebook Live website where you can access prior recordings. We have done many Facebook Live sessions during the pandemic, and we've been able to record those, and so those are available there. And then finally, the National Child Traumatic Stress Network also has some really fantastic resources, particularly for parents, for educators, for those working in child serving systems. There are really great resources there, and those are offered nationally. These are experts across the country who really focus on trauma and the results of trauma, and also support services and information that can be really helpful during this time. So those are our local resources, and we will have a flyer available afterward that lists all of this. It's a one-pager. You can print it or you can email it as a PDF to anyone who may need access to that information. So next, I am going to turn it over to Dr. Marianne Dewan, our County Superintendent of Schools, and she's going to go over some information with you.
Thank you so much, Sherry. And I also want to very much thank Supervisor Chavez for inviting us today and creating space to share important information with all of you in hopes that we can get these resources more prominently exposed out into the community. Before we go on with additional resource information, we do want to take another Menti poll question. So Alex, if you would please put the poll on the screen. And again, to participate, we'll ask you to go to menti.com. Hopefully it's still open on your screen, and type in the code that you'll see. It's going to come up here in just a moment, and we'll also share it in the chat, and I'll read it to you when it comes up. Our next question for today is, have you sought out behavioral health services either for yourself or for someone else? And the code for this question is 7712009. So if you would please go ahead and answer the question. The response for this one is going to be a dot graph, so we'll be able to see representation by the dots around the most frequently chosen responses.
Hey, Mary Ann, I think you're on mute.
Oops, sorry about that.
Sorry.
So the code again is 7712009, and the question would be at any time, either before or during the pandemic, if you've sought out behavioral health services for yourself or for someone else. We see the dots are still moving, so we'll take a few more seconds here to allow everyone to respond. So it generally looks like about half of us participating today have accessed behavioral health services for ourselves or someone else. And someone had requested to know about how many respondents were participating in today's Menti.com poll. And so far, we have 54 responses to this question. So we can see that if we're reflective at all of the community, then we know that there is some interest and need to have access to the behavioral health services in community. And sometimes we're the ones that help others find these resources as well. So Alex, I think we'll go on to the next slide. Thank you all for participating in the Menti poll. Questions are really helpful for us to shape today's agenda, but also to plan for future events. So as our previous speakers mentioned, there are resources available in the community, and certainly COVID-19 has changed a lot for families, and particularly families with children at home. So I want to share a few resources that are designed to help with behavioral health services, to provide supports in home and in other ways, because we know that opportunities for prevention and early intervention, and sometimes just in the moment support, can really be preventative and help parents as they're working to parent their children and do all of those things now at home, while perhaps they're doing many other things without the resources we're typically used to receiving. The first resource I want to share is our Inclusion Collaborative Support Warmline. We call it a warm line because it's warm, not hot, and not about crises, but really about ways in which parents can get support. Perhaps they're struggling with their child's behavior. This is a resource that's available for parents of children of all ages. We also have expanded the warm line this year to be available in 5 languages. And additionally, we've included access to resources for distance learning and access to digital equity materials and referrals. So a call into the warm line might provide the parent with immediate support. It may also provide support and recommendations and referrals into a school district, a clinic, or another support provider, dependent upon the need that the parent might have. Go on to the next slide. And another area that has been giving parents concern and anxiety has been limited access to some of the programs that they might have been expecting to be available this year. We're seeing, for example, limited enrollments in preschool and transitional kindergarten and kindergarten. And parents are also starting to plan and wonder about next year. And this is creating some anxiety for parents, and also their struggle about how to access the system and what to do next. And to try to combat some of this social isolation and to help parents with their plans for the future, we have an early learning campaign which coordinates all of the information that parents would need in order to help them get their child enrolled in preschool, transitional kindergarten, or kindergarten. It's a one-stop shop. It also helps parents understand the ways in which they can access safe, equitable, and inclusive high-quality early childhood programming. This is live on our website, and it does link parents to information in their local community. Next slide, please. We also wanted to share information about the Child Care Resource and Referral Program as another component where parents have been asking for resources. Perhaps they need respite. Perhaps they need a place for their child to have safe childcare for a portion or all of the day. And ways in which families can find a resource and referral program is on the website childcarescc.org. They can find access to high quality, safe, licensed childcare for all ages, and also understand that the childcare programs are meeting the health and safety standards during COVID-19. Families need assistance with finding a provider that meets their needs, or if they need assistance in submitting an application for childcare, we also have a phone number. So we know that the website is not always the easiest way for families to navigate. And the phone number is 669-212-KIDS. And we will put that number in the chat as well. Another component of isolation that families have had has been separation from their typical physical wellness checks and access to their pediatricians or perhaps their local clinics. And we know that physical health and mental health and wellness are often overlapping and integrated. And so we wanted to share the information today about the school health clinics of Santa Clara County. So go to the next slide. We can share this information about how to access community health clinics in the areas where our children and families live. And these clinics provide, in addition to pediatric and wellness care, vaccinations, screenings, and other services, many also provide behavioral health services and counseling services for their patients. Next slide. A large sense of anxiety and concern that's been exacerbating some of the challenges for families has been trying to navigate distance learning. And so we wanted to share some additional resources for families to support their distance learning efforts. And those resources can be found on the SCCOE Learning Resource Portal, which is linked live on this slide. Additionally, the Santa Clara County Mental Health Plan has specialty mental health services available for children and youth, and that can be accessed at the phone number listed here. And then there are also resources available online at the California's Mental Health Movement Resource Center. And this particular resource center is a way to provide activities, ways to have conversations, and support services that can be easily accessed via the website. Next slide. In partnership with the County Behavioral Health Services Department, we have been encouraging families to learn ways to cope with the stress associated with COVID-19. And we have linked here 2 flyers. The images are shown here, but the links are live. We'll take you to the flyer. The first one is coping with stress, and this is for more the general community. And the second one is coping with stress while taking care of children. And so great resources available there. Next slide. And then the crisis hotlines that we wanted to share. We have been seeing increases in the numbers of young people reporting significant anxiety and suicide ideation. And we've also seen an uptick in the numbers of young people lost to suicide during COVID-19. As a result, we've really amplified our efforts to get out crisis hotline numbers into the community. The first one is the 24-hour suicide prevention lifeline, which is also available by text. And the same phone number is utilized for the National Suicide Prevention Lifeline. And then lastly, the California Parent and Youth Helpline is listed there at 855-427-2736. So really, in the spirit of community, it is imperative that we are all able to take care of each other and lend a supportive hand to those in need. And we believe that these resources are some of the best available and can be easily shared with others. Next, I'd like to turn it back to Sherry to continue sharing about resources for behavioral health services. Thank you, Sherry.
Thank you, Dr. Dewan. So this slide focuses on our County of Santa Clara Behavioral Health Services Department and offers some information on our vision and mission. But I think what I'd like to highlight is just really our mission, and that is to assist individuals in our community affected by mental illness and serious emotional disturbance to achieve their hopes and dreams and quality of life goals. Our belief really is that services must be delivered in the least restrictive, non-stigmatizing way in the most accessible environments within a coordinated system of community and self-care, respectful of a person's family and loved one's language, culture, ethnicity, gender, and sexual identity. We offer an array of services, and in the next couple of slides, I'm going to be talking about both our children's system of care and our adult system of care. And on this slide, you'll be able to link to our Behavioral Health Services Department website, where we have many resources and information on our programs, our systems of care, and ways to access information that you may need. So please, if you have a moment, please check out our website. Next slide, please, Alex. So Dr. Dewan provided a lot of really important information related to children and youth. And this particular slide details our children and youth and transition age youth and family system of care. Our programs are really organized across a continuum of care, starting from prevention and early intervention, all the way up through more intensive services such as residential care. We offer services associated with schools. We offer school-based counseling. We offer programs in our community through both county operated, and we have a wide array of community-based organizations that provide about 70% of our services across our system. So within our prevention and early intervention, we have services that are really intended to support children and youth who may not fully have a mental health condition, but may be beginning to show signs and symptoms. And so the idea really is if we can intervene early, we can provide supports to both the child and family at an earlier stage, hopefully preventing the need for additional resources. Our outpatient programs provide outpatient counseling both in community settings and in clinics across our county, and those are available, all the way from North County up in Palo Alto, all the way south to Gilroy. And those services actually range in variety and intensity. So if a child or youth really has a more intensive need, the agency and program is actually able to adjust the programming to really meet the need of that child. We also offer intensive wraparound services, which involve 24/7 teams that can provide more intensive services and supports both in the community and in the home. And then finally, at the most intensive level is our residential care, where children and youth are able to receive what we refer to as short-term residential therapeutic program and services. As part of our adjunctive services across our continuum, we offer a program called Therapeutic Behavioral Services, and those are more intensive services focused on targeted behaviors. And as I mentioned on the earlier slide, we also have our mobile crisis team for children and youth, and that is offered through Uplift Family Services. And again, that's a 24/7 resource for anyone who may be experiencing a crisis in the community. Next slide. This is another program that I wanted to highlight. We are about to offer a new program called Alcove. Alcove was a program only offered in British Columbia and Australia. It's a one-stop integrated health model, and we will be offering Alcove in Palo Alto and San Jose. But leading up to the opening of Alcove, we wanted to be able to make services available virtually, understanding that during the pandemic, it isn't always possible nor easy to get to a clinic to receive services. And so what we've initiated in the interim is something called Virtual U, and it's an opportunity to navigate wellness online. And so we offer engagement, education, and wellness activities for youth and young adults ages 12 to 25. And we have a wide array of services, drop-in groups, and different activities that youth and young adults can access virtually. So for more information, we have that available here on our slide. And so please feel free to call us, or you can check out the Virtual U video to get an orientation to how these services are delivered. Next slide, please. So as I mentioned, we have an entire service delivery system across the lifespan. And this particular slide highlights our adult system of care programs. So these services include clinics across, again, the entire county. We offer outpatient and intensive services. And for the adult population, we also focus specific services around different target populations. So for those individuals who may be involved in the criminal justice system, who may be coming out of custody, we have an entire array of services and supports supporting individuals who may have unique needs coming out of the justice system. And then we have a wide array of substance use treatment services for adults, including outpatient services and residential care, as well as medication-assisted treatment. And medication-assisted treatment is really the combination of FDA-approved medications along with treatment to assist individuals who are experiencing substance use treatment, substance use conditions. So we have a wide array, again, of services. And as I mentioned, you'll see at the bottom of the slide, our mobile crisis response team. And again, those services are available 24/7 for any adult who may be experiencing a crisis. And Dave, who opened with us today and is the CEO of Momentum, his organization offers many of these services, both for our adult system as well as our youth system of care. Next slide, please. Amongst our adult system, we also have some different specialized programs. We offer what we call our Q Corner, and these are specific services for our LGBTQ population. We also offer clinic-based services out of different Valley Medical Center clinics across our county. We've started a new mobile response program called PERT, or Psychiatric Emergency Response Team, and that involves a licensed clinician paired with a law enforcement officer going out and providing support and response to mental health crises that may occur in the community. We've developed peer linkage innovation projects, as well as an interactive video simulation training for those going out in the community in partnership with law enforcement. And finally, I think it's really important to note that a lot of our services and supports are tied to housing. And so we have housing services in our adult health system, which really works collaboratively with our Office of Supportive Housing to ensure that individuals that are experiencing mental illness or substance use conditions are connected with housing. So it's so critical for individuals to be housed in order for their treatments to be supported. And so we offer permanent supportive housing, connection to benefits, primary health care support, as well as I mentioned, substance use treatment. Next slide. I'm going to move a little closer to the mic. Thank you for that feedback. So some of the additional behavioral health supports and services include telehealth and in-person services. During the pandemic, it was really critical that we could quickly ramp up the opportunity to provide services via telehealth. So those are offered either telephonically by phone or via, similar to what we're doing on Zoom, they can be offered through video conferencing software. What we've noticed during the pandemic is oftentimes individuals may have difficulty remaining on a video conference for an extended period of time. And so we have been at times shortening the behavioral health sessions, but increasing the frequency of those sessions. So holding sessions more often and more frequently in shorter periods or duration. We've also offered therapeutic care packages for youth during this time. It's been really critical to reach out, as we've mentioned throughout the presentation, the ideas around isolation and lack of connection are really prominent during the pandemic. And so we've found it to be really critical as part of our care management program that we do actually reach out and provide these care packages. Some of the interventions that we've really worked on providing during this time are really focused on instilling hope, ensuring that natural support systems and relationships are bolstered during this time because of the isolation and because of the lack of connection for in regular times where we would have more frequent contact. We've encouraged keeping to routines, spending time with family and friends. We've been providing quite a lot of information on mental health awareness. And you'll see some of the other suggestions that we provide, writing in a journal, figuring out ways to kind of self-regulate, focusing on breathing, taking moments and creating space for yourself to really try to focus in and try to recalibrate yourself during times when you may feel, excessive stress and anxiety. On the far right, we highlight some of the Facebook Live sessions that have been recorded recently. And I would encourage you to click on the link in the previous slide to be able to access some of these Facebook Live sessions. They're very educational. We've provided information on different topics with respect to parent-child relationships, how to protect yourself during COVID, understanding the needs and risks associated with children and youth. We've focused some on substance use, more prominently addressing the opioid and fentanyl crisis that has really been significantly increased during the time of the pandemic. And then finally, just ideas about how to help our youth and young adults cope during the pandemic is another really important session that we recorded. Next slide. Okay, so I think what we're going to do now is we're going to take you to our last mentee poll question. So I'll ask Alex to pull that up. All right, so we're going to ask you to go back to menti.com, or you may have it up on your smartphone. And the code is 8117100. And we're going to ask you to answer the following question. And that is, how hopeful are you feeling today about the recovery from COVID-19? And on this particular question, there will be choices. So your choices are very hopeful, somewhat hopeful, not very hopeful, or not hopeful at all. And again, the code is 8117100.
So this is Cindy. Alex, I just wanted to see if we can pull up the screen as it's coming up.
Supervisor, this is the screen that should be displaying the results. I see that 57 of our attendees have responded. Let me see if I could.
Oh, maybe it's waiting for us to respond because maybe this isn't a Word one. Okay, I know nothing about technology. I'm sorry, I was trying to be helpful. I'm done. I'm done with my helpfulness or lack thereof.
I know, I don't know how this one's going to show up as far as the answers go. Oh, there we go. I think it probably just needed to be refreshed.
Yeah.
Okay, so it looks like with respect to how hopeful the group today is feeling, we see about 33% as very hopeful, 56% as somewhat hopeful, and still folks feeling not very hopeful at 11%. So understandably, I think this is a really challenging time and, you know, a lot going on. But again, we thank you for taking the poll and sharing your thoughts with us. So at this point, I'm going to turn it back over to Supervisor Chavez, and you're going to lead us in the Q&A and final comments.
Absolutely. And I just want to do a real quick time check for folks. We were going to end in 6 minutes, but I know there's some questions. And so what I was hoping we could do, if it's all right, if we could go to 3:15, I'm going to ask our panelists that, if that's okay. And there's some questions in the chat that I'll just answer one of them, and then I'll go to raised hands and then back to the questions in the chat. So one question we got was whether or not we would be doing this training in Spanish. We will be doing it in Spanish and in Vietnamese. This was our first go. We just did our first Spanish ambassador training earlier today, which went great. Magdalena and Rebecca and our staff was amazing. So we'll absolutely do that. And I will then turn to our first, if I could get, we have a hand raised. So we'll go to the hand raised first, and then we'll go back to the chat for questions.
Thank you, Supervisor. We have Lance who would like to ask a question. Lance, I will be sending you a request to unmute. If you could please accept the unmute.
Okay, can you hear me?
We can.
Yes.
Awesome. So one of the things I noticed from that first questionnaire about whether people have reached out for support, 50% said no. It would be very helpful to understand, of those 50%, why? Did they need outside help, or were they reaching out to family members, friends, others within their support community or support group? And if they're reaching out within their own group, that's kind of a different form of targeted help that we could give, is to help keep more people informed. So then when others in their family and friends group reaches to them, they have factual answers. So the next step of, now that you've broken it down outside inside, is find out which way the inside group is split up. That's all. Thank you.
Thanks, Lance. Appreciate the thought. We'll go to Carmen.
Carmen, I will be sending you a request to unmute. Please accept the unmute.
Yes, good afternoon. My question is, are all these services only for people that have medical insurance, or it applies to insured and uninsured individuals?
Great question. Sherry, can I turn to you for that?
Sure. So some of our services are focused on our Medi-Cal beneficiaries. So through our county mental health plan, we primarily serve Medi-Cal beneficiaries. However, some of the services are available to those without insurance. We frequently will provide services to those that are uninsured, as well as those with Medi-Cal. Many of our prevention and early intervention services that I've highlighted today are available for the general public. So the services that we described that are available in schools are available to students on campuses. So it does vary. And I think what I would suggest would be, if there is a question about access to a particular service, calling our call center. They're able to answer any question you might have related to eligibility or access. And so the 800 number that I provided on the earlier slide is available to anyone to call if you have questions.
Cindy, or could I also just add a little bit also to what Sherry just said, in that, Carmen, also in addition to public insurance, there's public sector insurance. There's also many folks who are trying to access through their private insurance carriers. And I would again just point out that California had passed a parity law last year in 2020 to make sure that the federal parity law is strengthened by California's parity law, where insurance carriers, really must offer behavioral health benefits equal to the general health benefits. So this is one of those times where we do think that there is a behavioral health tidal wave, tsunami for some, that is going to be across the entire sector for folks who don't have insurance, folks who have Medi-Cal on public insurance, as well as folks with private insurance as well. And it just is incumbent upon the entire system to gear up for what we believe, and we are already seeing those leading edge data indicators right now.
Okay, so the resources that you provided, we can reach out to them for this type of individuals?
Yes.
Yep.
Okay, perfect. How about the undocumented community?
Yes.
Okay, perfect. Thank you. That was my question.
Thank you.
Janet, and then I'll go to the chat.
Janet, I am sending you a request to unmute. Please accept the unmute.
Okay, thank you very much. I appreciate that. This is wonderful. This is great. And I'm really happy that you're going to be emailing us the different links. I'm going to put it up on our neighborhood associations websites as soon as I get it. Here's a couple of different things that I've just been hearing over the last couple of days. It's been bothering me. It's a little bit more the elderly or the folks that live alone. So somebody without any other support and they're not really able to travel to go see their family or siblings are really starting to suffer. They're missing, missing the grandkids, they're missing the milestones. And this was just brought up today. Another big one is a really huge amount of frustration with folks who have signed up for vaccinations and then the appointments are pulled back. The reactions that I've seen from these folks who've had their appointments pulled back are like, okay, I'm just going to sit and wait to, and I'm not going to say the next word, but very frustrated and almost hopeless. And I know, I've said, look, go to the county and get your, just do your thing and keep trying for an appointment. But I'm just there to say that some of the inconsistencies are accelerating the frustrations and the anxiety, and then the the lack of being able to see people. But you need to stay safe. So it's that's all I have to say. Thank you.
Thank you, Janet. And the one thing, I'll just see if my colleagues want to respond to that. But one point I would just make is that what I appreciate about getting your feedback is it's a reminder to the county and to the state and federal government that the inconsistency is as traumatizing as the challenges that we face. So that's good feedback for us and a good reason for us to be as disciplined as we can about information. But Sherry, do you want to, or David, do you want to talk about what's available for folks who are older and maybe isolated? And that question came up a little earlier in our chat too.
Dave, do you want to talk a little bit about the older adult programming that we have available? And
yeah, and just know that I think that is an excellent question, and that that a few years back when I was in the federal government, we were inside in SAMHSA and other behavioral health serving agencies talking about sort of the silver tsunami, the aging of our population and the baby boomers. And now that we're here, and that is one of the concerns, I think, for the system, there's been an increased emphasis on from the county behavioral health department, from Sherry's department, on senior services and services to our geriatric community. And so it is something that the providers, we have 30 plus providers, nonprofit providers and more in the system, as Sherry said, providing services. And I think you see us sort of ramping up for that change in demographic in many ways. And so there's been an emphasis more on looking for specialists who can work with our senior population and across cultures, across languages. That's the other piece, right? Is we've also seen that the pandemic has affected, and we see data on this all the time, disproportionately certain communities. And so, so my concern, or our concern on seniors, as you pointed out, again, for historically underserved populations, it's even greater. And so ironically today, as we're discussing this, Janet, your point, I invited my mom to this today, right? This is one of our ways, checking in. I got to check in with my mom. I want to check in with my mom, but I want her to hear this information as well, and be able to discuss it with her friends, because they're all at home, sheltered in place, and having some of those same, I think some of those, exactly your point, some of those same feelings of missing the grandkids, not being able to hug their grandkids, not being able to hug us. We can't even go over there. So again, I think it goes back to some of those, also that's third slide on what we can do to try to stay healthy, put that and think of that for seniors specifically, right? And overlay that for our senior community as well. We just have to I think we have to get this information out to more folks. That's part of the key.
And that's why we're grateful to you. Sherry, did you want to add to that?
Yeah, I was just going to add, I appreciate Dave's comments. I think the other thing is with respect to isolation, and there are alternatives, as we know, to try to reach out through technology, which sometimes may be difficult for older adults. But I think encouraging any type of contact, even while social distancing, is really important. And just trying to stay connected through other means, letter writing, trying to send some kind of connection that way can be helpful. I think the other thing with respect to any depression or anxiety with older adults is if there are opportunities for primary care visits with their physician, to be able to mention that, because sometimes, physicians can also provide some support suggestions or ideas. And so bringing that information, I think, to the primary care conversation is also really critical.
And as I go to Louis Rocha, I will just respond that it's also, as neighborhood leaders, being able to be socially distanced on someone's porch and check in on our seniors on our street, whether that's through a window or a door very far away. That's a way to do that. Louis?
Thank you, Supervisor. Louis, I have sent you a request to unmute. Please accept the request. There you go.
Okay, thank you. Thank you so much for this very insightful training session. My question is, do you have any guides or even a one-page guide for families that are debating and are stressed out about the shifting vaccination population, the priority? Because recently we had a family not a squabble, but it was a debate about whether seniors should be first in line versus first responders or essential workers like teachers and agricultural workers. And it's really pitting families, generations within families about who should get the shot first. And it's creating a lot of added stress to what, we were already faced with. So my question to the panel is, what suggestions do you have? Are there any talk pieces that families can share, ambassadors can share, to how to deal with this evolving priority list? Because I would gladly wait until my kids are teachers, nurses, and other that are essential workers. But I know others within my elder senior bubble are not in the same frame of mind. They're freaking out. They're really concerned, and rightfully so, about their health. And so I would just, asking this in general, because I think it would be helpful for us to help families as this situation evolves, because it may again shift in another month or two to other groups. But right now it's really causing a lot of stress and friction within families on who should be next in line to get the shot, or who should be moved aside so others can get it. So I think you get the gist of what I'm asking.
Thanks, Louis. That's a really thoughtful question. I don't know if David, Sherry, or Dr. Dewan, if you're already addressing that.
I would just offer that it's something we could take back to our stakeholder group that's working on messages for community, and how we can help emphasize, the rationale around the current vaccination schedule. And it's really, sad to hear about how it's pitting families against each other, and just a word of reminder that when there's scarcity, that those types of emotions can run high, and so we want to combat it with as much factual information as possible.
Yeah, I would only add, and I think you described that, Louis, as well as about I think anyone could. I mean, I think that sort of conflict and within families and those discussions, hard discussions that are going on. One thing that I would share is, though, is this again, the plan is to be able to vaccinate everybody, right? Is to get it out. It's a timing issue, and it's a rollout issue, and it's probably going to be, we're going to look back on this, going to be one of the most significant health rollouts ever in the country's history. And it's happening in real time, and we're all learning as we go. So part of that, all that stress around all of this historical rollout and the historical pandemic, part of it is to find ways of sort of settling ourselves. And if it is a matter of weeks, maybe months, as they've said, around the full vaccination for the entire population, it's to maintain our precautions that we're doing, try to set up these connections, and because folks could be waiting for some time. I mean, that seems to be a reality now.
Yeah, and I'll just say, if I could, I think this is a good thing for us to take back and really think about, because everything that has been said is accurate. I do think that one of my takeaways from just even hearing from everybody today is that we do need to hone in on in a very timely way to the issues that people are dealing with. And we've been thinking a lot about that relative to food. I think the reason I appreciated David bringing us together today, honestly, is that this is giving us an opportunity to think about what tools we need to have in people's toolbox. And I think, Louis, you've just reminded me that this is a very real tool. And then the other, and I'll just say this to Sherry and Dr. Dewan and David, that all of us who are part of these working groups, we really need to reinforce for our institutions the role we need to play so that we don't create more trauma. Because what you're reflecting is that the indecisiveness is as traumatic as the decisiveness. And when we're toggling between being decisive and indecisive, it's just, whipsawing every individual in our society and whipsawing people against each other. But let us take that back, Louie. That is a really thoughtful point. We're going to go to Tina, and then I'm going to, and then as Tina gets the unmute request, I'm going to acknowledge that the silver tsunami is very real. 10,000 people a day turn 65 years old and have been for years. And businesses are closing by baby boomers. And this creates a lot of stress, and the worker cooperative movement provides a successful way to exit your business. It would be great to find ways to further get the word out. And the city of Santa Clara has a worker cooperative initiative underway, and it could be a resource to the county. Thanks, Kirk. All right, Tina.
Supervisor Chavez, thank you so much. I have brought this issue to your attention a couple of times in the past, and I know you have been working hard and trying to help. So I would like to reinforce some of the comments that have been made. And I agree with you, it's the inconsistency in the vaccination and the indecisiveness that is causing the trauma. My concern goes especially to seniors in their 80s and 90s who are independent, living alone, have insurance, but are tech savvy and have spent hours on the telephone, but are unable to get an appointment for a vaccination. Some of the comments I am hearing from these people are they do not have the 6 months to wait for their turn. Mm-hmm. And so I'm not going to repeat myself. You've heard me, so pardon my saying so, I'm repeating. These are the people I feel we need to somehow find a way to reach out to. They are isolated. They are reaching out to their primary care doctors. The support system they get from their insurance is standard. It's not geared towards these atypical situations. Mm-hmm. And if they are connected, either they're offered some medication or they are connected with a 25-year-old or a 30-year-old, that does not address their challenges. You're all doing a great job. Please keep this demographic in mind as well. People who are living alone in their 80s, 90s, and have health insurance, but cannot get vaccination appointments.
Yeah, and one thing I'll just add, and I apologize that that's going to need to be our last comment just because we're over time, but I want to make a couple recommendations to my colleagues as well. So one thing I'll say is that today, every Saturday, we have a meeting with all the mayors and city managers in the county. And one of the things that we're working on is uniting all the cities to do phone banking to older members of the community, both to assist them in getting vaccinations, but also I think it's actually a very good way to do a check-in with our communities. And so that working group is being led by the city of Cupertino, Deborah Fang, and Steve Preminger, and also I apologize, there's a third person from the county that's playing a leadership role in that. So that's one thing we can come back and share with all of you as our ambassadors about those programs and how to make sure that, you know, folks that you want to make sure get included in that program can. So thanks, Tina, for staying on us about that. In fact, I think Tina's mayor of Saratoga, vice mayor of Saratoga, so thanks for being with us. The other thing I just wanted to add is that I'm going to recommend that if you all think this was helpful, that we fold in another one of these maybe in a week or 10 days with a little bit longer time, maybe an hour and a half, so that as we send out these resources to you, you'll get the link, I think was put in the chat for the video, but we'll give you the link for this video along with the slides. And as you get information out, what we can do is make the next session even more interactive and get your thoughts about how were the services received? Are people using them? What services are we missing? And we got a couple questions that I just want to kind of hit on that I know are, you know, Sherry doesn't sleep thinking about this, but one of them is that, you know, do we have enough resources? The answer to that is, if everybody used them, probably not. So we really want to push these services out. If we get lines, that just helps Sherry and David and Dr. Dewan understand what to prioritize next. So you know, if that happens, just let us know. We want that information. The second thing is that we will get information out to you in Spanish and in Vietnamese. I know we have those languages, but we'll work with Sherry's office to send that out. And then the last thing is that when in doubt, use 211. And I just want to encourage people, 211 is our, you know, we have 911, we have 311, and we have 211 for resources. The county's really investing quite a lot of resources in 211. And for seniors in particular, it's so much easier for them to dial 211 than a lot of the information that we've given you. And that includes people who need food, they may need counseling, they may need something else. But if when in doubt, you know, if you feel like we didn't cover something, again, let us know. Now, the good news about 211 is that if they can't find the resource they need, they're going to call Steve Preminger in our county, and we're going to figure out how to connect it. So we really, really, really appreciate you and Noreen. Great idea about sending out a mass mailer with these numbers for our seniors. That's just genius. And you guys have been great. Like, I got a new wristband idea today, and I'll assure you our staff's going to be not excited that I spent all this time with you. So with that, I do, if folks are interested, when we send out the links and the other information from today, feel free to shoot us an email saying this was helpful, it wasn't, what else would you like to learn about? Could we do this in an hour and a half for the next time? Would you be interested, and this is probably the most important question, in doing this again? Because I think that, you know, we'd want to know that, because if so, I think Sherry and David and Dr. Dewan could all be, you know, be encouraged to join us again. And we will be putting something like this together in Spanish and in Vietnamese in short order. So Sherry or David, Dr. Dewan, did I forget anything you wanted to raise? No, you're good. Thank you so much, David, for the brilliant idea, and Paul for pulling it together, Sherry for all that great information, Dr. Dewan for all the great information. You all amazing. I want to thank all of our ambassadors. I hope this information is helpful. I recognize we're in a struggle for our community's health, and we're going to fight to make sure we can respond to every person. So you're going to help us do that. So thank each and every one of you for joining us today. And please, when you respond back, we want to know, do you want to do it again? What other information do you need? Thanks, everyone. And we'll leave the chat up. So if you want to keep adding questions, go ahead and do that. We'll leave it up for a few minutes, even if our panelists have to leave, so we can gather information from you. And feel free to shoot us an email as well. Thanks. Good job.